Good afternoon. I'm Wendy Sofolo. I'm the Director of Post-Acute Services at KSB. Today we are further exploring caregiver support group. We have today Satin Likes, who is our clinical educational specialist for home health care. She's been an RN for 11 years and worked the last 4 in home health care. And we have Emily Leffelman, who has been an RN for 4 years and has worked the last 3 in our home health care. She also has a certification as an ostomy management specialist. So we'll go ahead and talk about tubes and drains that you might see in your patients or family members who come home, and common problems and questions that come up regarding those. You can ask questions as we go along in the chat, and someone will monitor those and respond to you. So, Satin, let's go ahead and start.
So a lot of people that have catheters ask, how do they clean their catheter?
So one of the main things is you need to make sure that you're going to clean it twice a day. And if you're a male patient, if you are uncircumcised, you need to make sure that you pull back your foreskin, clean all the way around the head of your penis, and then you need to clean at the side of the tube. So you've got a Foley catheter right here. You always want to wipe down and away from the tube, away from your body. It's really important that you do this, like I said, twice a day. With a woman, you want to make sure that you clean always from front to back. Again, with the tube, you want to make sure you grasp the tube and clean away from the body.
Another question we often get is, do I need to clean my bag, and how do I do that?
So some patients have an overnight bag, which is what this is. So you've got a large bag. If you are changing to a leg bag, then what I need you to do is you're going to disconnect from this point right here, okay? You're going to take that apart, and after you drain it out, I just need you to rinse it with clear water, let it drain, and then you're going to let it dry overnight, or during the day, sorry. Whenever you disconnect, what you need to make sure you do is on the end of the drainage bag. So this little part right here, you need to make sure and keep that covered with an alcohol wipe of some sort. So if you've got an alcohol swab, if you just tear it off, put it around that, and then leave it where nothing is going to disturb it until you're ready to put it back on. Sometimes, if you're having retention, you will need to have a catheter. Retention means that you're not able to empty your bladder fully, which can occur for a multitude of reasons. Sometimes with gentlemen, it's due to an enlarged prostate. Some other reasons is after a surgery, you may need a catheter for a short time. And we do also have patients who have what we call neurogenic bladders, who are unable to control their bladder, so they have a chronic catheter for life.
And so the principles of why are we washing like that? What's the point?
What's the point of washing like that?
In those specific
Oh,
ways.
okay. So the importance of washing away from the body, what is the importance of that, is to make sure you're not going to introduce bacteria into the body. So that's why we always want to wipe away from the body so that no bacteria is ever tracked back up into your urethra, which is where your catheter is.
Okay.
So how would I know if I had an infection?
So signs and symptoms of a urinary tract infection are going to be a fever. You can have cloudy urine, foul-smelling urine, possibly blood in the urine. You can also have a feeling of pain. It may be burning, or it just could be uncomfortable pain. Anytime you're experiencing symptoms like that, you should always call your doctor in case they want to have a urine sample to see if you are experiencing an infection.
Are there any other reasons I might need to call the doctor? Any problems I might have that I can't maybe take care of myself that I need to call the doctor for?
So if one of the important things is to make sure you have enough urine output. So you should have about 30 mils of urine every hour. What did we decide that was, about 240 mils?
It's about a cup.
About a cup every 8 hours. So if it doesn't look like you're getting that much urine out, you need to make sure and give your doctors a call. They may say that you need to increase your water intake, or possibly you're having a problem with your kidneys. So that's why if you notice that you're not having enough urine output, you should also call the doctor at that point in time as well.
There's a lot of patients too who initially maybe have the Statlock on and it comes off and they don't think about putting it back on. Maybe touch on the importance of the Statlock, why it should be there.
So a Statlock is actually this right here, okay? And what this is for is it gets attached to the inside of your thigh, and the catheter gets snapped into place. So it goes in, snaps into place, and it stops it from being dislodged. It's very important because if at any point in time you roll over in bed or you forget that you did not pick up your drainage bag when you go to walk away, you have the chance of pulling this out of your bladder, which can be very painful and cause trauma. So it's very important to always make sure you have some sort of stabilizing device. We use Statlocks here. Sometimes people also have Velcro bands that they use around their leg. Either is fine, just make sure that you always have something to stabilize the catheter to your body.
And what should you do if it comes out?
If the catheter comes out, you need to call your doctor right away. Depending on what the doctor tells you, you may go into the office or you may be instructed to go to the emergency room.
So what keeps it from falling out?
So,
It doesn't look very big.
it doesn't. So right now, there is the balloon that normally is inflated. So when it's in your bladder, this pops up to be about this big. That balloon holds it right there into your bladder so that it can't be dislodged. So that being said, if you were to pull it out, it would be quite uncomfortable and painful, as that is a very large balloon and this tube is very slender.
What about carrying that bag along? Can I just like wind it up and carry it like a handbag?
No, good question. So it's very important that whenever you have a catheter, you always keep the drainage bag below the level of your bladder. On top of it being below the level of the bladder, you've seen there's quite a bit of tubing here. We need to make sure that there's no loops or kinks. So it's best practice to keep it off of the floor, okay? You do not ever want this to touch the floor. So if you have anything that you can hook this on, just keep it a little bit off the floor but below the bladder. That's going to be key. You want the urine to be able to free flow into the bag. It stops it from backtracking up into your bladder.
And that's important for that same purpose, to keep bacteria out, is that it?
That is correct. Yep.
If there's someone who switches from a leg bag to a Foley bag, can you wear the leg bag at night?
No. No, you cannot. Many people don't want to have to change back and forth. However, a leg bag, which I do have a slide of right here, it gets attached right to your thigh, and it's a smaller bag. This larger bag here can hold about 2,000 mils, where a leg bag holds about 500. When you are laying in bed, that would cause the urine to track back up that catheter. It would not stay in the dependent position. That means below the level of the bladder, because you would be laying flat. So that's why it's important whenever it's nighttime and you are going to lay down in bed that you put on the larger drainage bag to make sure it stays below the level of the bladder and you don't have any urine backing back up.
So biggest things to remember are keeping it clean, cleaning under the foreskin if you're an uncircumcised man, if you're a woman, washing back front to back, and keeping it below the level of the bladder. And all of those are to help prevent either trauma from yanking it out or infection.
Correct. One last piece I just want to add. Whenever you are changing back and forth from bag, always make sure that you clean the port with alcohol. So the port that connects to your catheter, please always wipe that with alcohol before you reattach your bag.
So next we are going to talk about Jackson Pratt drains. Well, I guess you want to hold up the
Yep.
picture to show what that looks like. Okay, so why would someone need a Jackson Pratt?
So typically after a surgery, if there's going to be excessive drainage in an area, they will put in a Jackson Pratt drain. So you're going to have this until all of the drainage gets decreased, I guess I would say.
Why would you put a drain in versus not put a drain in?
Okay. So when it comes to having drainage from a wound, if you have an excessive amount of drainage, it's always good to be able to collect it. You don't want to have to be changing a dressing every hour on the hour because of the amount of drainage coming from an incision.
How much should be coming out? Is there a certain amount?
There's not a specified amount. What they do want you to do is make sure that you are keeping track of how much drainage. So they recommend that you measure it every 4 to 8 hours depending on how much drainage you have. If you have this ball, if it fills up, then you need to drain it. Sometimes that doesn't happen in a 4-hour time frame. Sometimes it happens in 1 to 2 hours. Whenever the ball is full, you need to drain it and measure and record for your doctor, or every 4 hours at least, just so the doctor can track when it will be appropriate to discontinue that drain.
What should the drainage look like, or what should it not look like?
So what you don't want to see is what we would call purulent drainage. So that would be like a yellow, green, creamy drainage. That's what we're not wanting to see. If you ever notice drainage like that, you want to make sure and call the doctor. That could possibly be a sign of infection. It's normal to have bloody drainage. It's normal to have, we call it serosanguinous, which would be like a light yellow with pink tinge to it. Those are all normal drainage that you would see from the body.
And I see that the ball is inflated. What if it is deflated? What does that mean?
So what you want to do is you want to make sure that the ball is compressed, okay? When it's compressed, what that does is it creates a vacuum. So the vacuum is what's pulling that drainage out of the body so it can collect in that ball so that you can record that for the doctor.
So what other instances would you want to call your doctor or your home health nurse?
So if you are feeling warmth around your drain site, if you are having a fever, increased tenderness or pain, or if you are noticing that green, yellow, or creamy drainage coming from around the site, you should always call the doctor right away.
But blood's okay?
No, blood would be okay if it was a small amount. If you're having profuse bleeding from the site, you should call the doctor. If you're ever concerned that there's too much blood at one point in time, always call your doctor. There's nothing wrong with reaching out to your physician for their expertise.
Is there ever an instance where the tube might come out?
So occasionally, with a Jackson Pratt, it can rip out, which is unfortunate. We do always instruct you to try and pin it to the inside of your clothing, but below the level of the wound. If it does come out, you just simply need to call your doctor. They may decide at that point in time that you're just going to do a daily dressing change to that site, or they may decide that they need to actually reinsert another drain. One thing is stripping of the JP. So when you're gonna strip the JP, what that's for is to get rid of any clots that are in the line. You simply grasp the tube and you pull down and away from the body. That's going to make it so the drainage starts flowing freely again. After you're done with that, once you're going to empty and measure or create your vacuum again, you've got a little stopper that's on the top of that ball. What I need you to do is you pop it off. You'll empty your drainage into a cup to measure it, and then to create the vacuum again, you're going to compress the ball, and while the ball is compressed, you need to put the stopper back in the top of that JP. A JP is another word for a Jackson Pratt.
So next we are going to talk about Gtubes. So why would someone have a Gtube?
So it's a tube that goes into your stomach. Sometimes they're used for drainage. Other times they're used for feedings or medication administration.
How does it go into your stomach? Is it one of those that goes down your nose, or is it
No.
some other route?
So it's actually made by a surgeon. It is a surgical incision into your stomach through your abdomen. And there is a tube with a balloon that's holding it in place.
So kind of like the Foley.
It is kind of like the Foley. That is correct.
Can stuff leak around the Gtube and maybe cause my skin to break down?
So that is something that can happen. It's recommended every day that you clean around your Gtube site. So plain soap and water, just clean around the site. If it's breaking down, getting red, or possibly even weeping, you'll want to put what we call barrier cream. It's like Desitin from over the counter. You just simply put that around, and then you're going to put what we call a drain sponge, which is just a fancy word for gauze. So you're just going to take gauze. It will either be pre-cut, which is just one little line, one little cut in the gauze. It'll go fit right around the site to the skin, and you can tape that in place. And anytime you have drainage on it, you should change that. So 1 to 2 times a day, depending on the amount of drainage that you may have coming around that site.
I know if you use them for drainage, nothing will be going in, but what if I can't take anything by mouth and I'm needing to take medications? How would I go about getting the medications in?
So when it comes to medications administration, there's a few things that you need to focus on. You need to make sure that your medications can be crushed if they're a pill. Anything that's long-acting or extended release cannot be crushed. If you're ever in doubt of this whether or not a medication can be crushed, always seek out your pharmacist. Pharmacy, this is what they're trained in. They will let you know whether you can crush this medication or if you need to find an alternative, whether that be a liquid or a short-acting medication. In order to give the med, once it's crushed, if it is a pill, you need to put it in 30 to 60 mils of water, and you need to let it completely dissolve. Then, whenever you're going to administer it, you need to actually flush the tube, which means you need to take water, 30 mils, you need to let it go all the way through the tube. Then after your medication has dissolved in the water, you need to dump that down the tube itself. Once it's went through, you need to flush it again with 30 mils. The whole purpose of flushing the medication, flushing before and after, is to make sure that we don't ever clog the tube. It can happen pretty easily at times, so that's why always make sure your medications are dissolved completely. You should only ever put one medication in at a time. I will note that as well. It's hard sometimes because you may be taking 10 different medications, but you do need to have all of those medications dissolved separately and administer them separately.
How much is 30 mils?
30 mils, that's 1 ounce. In a medicine cup, what's real nice is that it's marked right on the side. It'll actually say 30 mils on it. It's about the whole length or a whole size of a medicine cup.
What if my tube gets clogged? What do I do?
So if your tube gets clogged, I need you to call your doctor. There have been many methods in the past that people have used, but at this point in time, the best advice I can give is seek out your doctor. You let them know that your tube is clogged, and they will instruct you what to do.
And is there anything that could potentially happen that would cause me to need to call the doctor other than a clogged tube?
So if your tube became dislodged, which could happen, if it ever came out, you need to immediately call your doctor. If it's on a weekend or after hours, you need to go to your nearest emergency room to have another Gtube inserted. Another thing I want to instruct you on, we know we talked about medication administration, but some people have feedings through their Gtubes. It's the only way they can take in nutrition. So if that is the case, you need to make sure that you flush with 60 mils of water before you start your feeding, and again, after the feeding is completed, you need to flush again with another 60 mils. This is just ensuring that we're not going to get any clogs.
Those are the most often or most frequently seen tubes in the home that we've experienced. If there are other questions regarding tubes or dressings or drains or ostomies that you'd like answers to those questions, please contact us because we have some experts in our midst. Thanks, Satin, for your expertise, and Emily for yours as well. Again, put things in the comments and ask questions, and we'll be happy to answer them. We hope to hear from you.